Right, now looking at some of the lower respiratory tract and infections that we see. First of all, starting with tuberculosis or TB. So this one has been around for a long time, even found in mummies back to the Stone Age or ancient Egypt. The discovery of streptomycin in 1943 significantly decreased the rates of this. However, it is now re-emerging due to the HIV epidemic, also drug-resistant strains. So right now, nearly about 1/3 of the world's population is infected. And primarily, tuberculosis is caused by the bacteria Mycobacterium tuberculosis. So just looking at this primary tuberculosis, this is very virulent, so only about 10 bacteria are needed to cause an infection. So these bacteria continue to multiply inside of alveolar macrophages. So the immune system actually engulfs them, but instead of destroying them, this bacteria is able to withstand destruction, and they actually reproduce inside of there. They cause tubercles, which are granulomas containing a core of these tuberculosis bacterium in the enlarged macrophages. That's what we're seeing here in this figure. They have this outer wall made up of fibroblasts, lymphocytes, and macrophages. So they become necrotic and cause these lesions to occur, and then the lesions can calcify. So again, this calcification is what we're seeing here as well. Right, there's a skin test, and if you've maybe already started some clinicals or you've worked in healthcare, you may have already had to go through on this. So there's typically a skin test that is done, and it's looking for a response of T cells to that Mycobacterium tuberculosis protein. So it does cause cell-mediated immune response, and then that evidence of the skin test is called the tuberculin reaction. So how this works is they're injected with kind of purified proteins from the bacteria under the skin. Here you wait about 2 to 3 days, and then a positive reaction would be this tuberculin reaction. So almost like an allergic response, you get this kind of hive that forms that indicates that mycobacteria are present or have been present in the body. Now, a secondary tuberculosis or reactivation, this is when dormant bacteria in the lungs become reactivated whenever they become immunocompromised due to different things. So another infection just kind of weakens that immunity. But they're able to remain dormant for weeks, months, even years later, which is the importance of having that skin test. This does cause a secondary kind of reactivation, leads to severe symptoms, violent coughing, kind of greenish or even bloody sputum, low-grade fever, anorexia, weight loss, fatigue, night sweats, and chest pain. And if it's left untreated, more than 50%, around 60 individuals with this will die. The again causative agent here, Mycobacterium tuberculosis. This is one of the acid fasts. So the Mycobacterium, this is acid fast. So again, with that acid fast stain, can be detected, but it has that waxy cell wall. So again, that's what allows it to remain in the macrophages and not be destroyed. They are strict aerobes, so they have to have oxygen. Takes about 15 to 20 hour generation time. So rather slow reproducers due to that waxy layer that gets made. They produce what's called a cord factor, which is what leads to that waxy cell wall, that mycobacterial cell wall. Again, it makes this mycolic acid and waxes, and it makes it resistant to drying and disinfections as well. In addition, there's a MAC or Mycobacterium avium complex. This causes kind of disseminated tuberculosis infection in AIDS patients and other immunocompromised individuals. Treatment for tuberculosis. So within the first couple months, there are various drugs that can be used. 4 to 7 months, only 2 drugs that susceptibility have shown to be effective. So again, early treatment is really important. Patient non-compliance leads to that drug resistance to occur. So there now is multi-drug resistant tuberculosis and even extensively drug resistant tuberculosis. So similar to our staph infections, this resistance is becoming a major issue. Looking here at the disease table, again, it's caused by the Mycobacterium tuberculosis. It is caused or transmitted in the air by vehicles or airborne. Again, that waxy cell wall and the ability to stimulate that strong cell-mediated immunity as part of the virulence. So avoiding those airbornes. Also, vaccination in some countries is available. Again, treatments depending on the length can kind of vary there. So up to 2 months or even 4 to 8 months of treatment. Some of the distinctive features here, it can remain airborne for long periods. Again, it can resist that desiccation or drying out. It is slow growing, again, compared to other bacteria due to that waxy layer, so it can make it hard or is part of how it is diagnosed and treated. Now, the resistant ones, whether it's multi-drug or extreme resistance, again, still caused by the same bacteria, same agent. It's just, again, the issue here is that this is the serious threat because of that multi-drug regimen that's needed, because it is resistant, it is harder to treat, and a much higher fatality rate with one of these types. All right, then spending some time here talking about pneumonia. Some of the anatomical diagnosis is just inflammation of the lungs and the fluids of the alveoli. So an x-ray of the chest can help with the diagnosis. It can be caused by a lot of different microorganisms, so bacteria, viruses, and fungi. They are able, though, to avoid phagocytosis or can avoid destruction by those macrophages. Viral pneumonia is usually not always, though, milder than the bacterial pneumonia, but again, fungi can also cause pneumonia as well. So again, about 50,000 deaths or so in the United States from pneumonia each year. Some of the signs and symptoms, the runny nose, congestion, headache, and fever. However, in the lungs, there's chest pain, fever, cough, and the discolored sputum that gets produced. Patients typically appear kind of pale and sickly. And then the severity and speed of onset depends on a lot of etiological agents. So which is causing it? I'm just kind of looking, again, here's that exudate like we'd seen with the ear infections that starts to occur here in the alveoli. And then that's going to allow, or is how it's able to cause that bacterial pneumonia. So again, the cells come in, they're encapsulated, and then they're able to get into the alveoli to cause that exudate. All right, now we have a community-acquired pneumonia. So this is caused by several things. So we'll look at Streptococcus pneumonia first. So these are small gram-positive, kind of a flattened cocci that appears in pairs. This is alpha hemolytic, so it destroys blood cells, but there are different types of hemolysis, so that helps distinguish or diagnose it. About 50% of healthy people actually have this in their normal biota. So again, it can be a secondary infection caused whenever the immune system gets decreased for different reasons. Then we get the normal flora kind of taking over and causing secondary infections. The infection occurs when the bacteria again is inhaled into the deep lungs or between two people sharing those respiratory droplets. A little bit more about this bacteria. So some of the factors that enhance the disease, elderly individuals, it can be seasonal, again, underlying respiratory disease like emphysema or COPD. Individuals with diabetes are more likely, and chronic users of alcohol or narcotics. These do produce a polysaccharide capsule. Again, that sugary layer prevents it from being phagocytosed. It also blocks the complement activation and can cause inflammatory fluids to build up in the lungs as it tries to mount this response. Vaccine is encouraged for children and those who are older. And it is resistant, though, to penicillin and its derivatives like microlids, tetracyclines, and fluoroquinones. It's also caused by mycoplasma. Pneumonia is another causative agent. This is causes atypical pneumonia, so the symptoms don't quite resemble those of others. This bacteria lacks a cell wall, so mycoplasma is the genus that actually doesn't have a cell wall, so it has different shapes to it because it lacks that rigidity. Transmitted by aerosol droplets. This is referred to as walking pneumonia. And essentially diagnosis is by ruling out the other causes. Another causative agent, Legionella pneumophilia. This is kind of weakly gram-negative that has a lot of different shapes to it. It's actually associated with human disease after the American Legion Convention in 1976 outbreak that this became more of an issue. It's widely distributed in aqueous environments, so in tap water, cooling towers, spas, ponds, fresh water. It is opportunistic. So again, those who are elderly, it is rarely seen in healthy children or adults. Another causative agent, Histoplasma capsulatum. This is known as Darling's disease, also called Ohio Valley fever or spelunker's disease. So spelunkers, thinking about those in caves. This can be benign, so like no symptoms, or severe, can be acute or chronic. Most serious forms, though, are seen with those individuals with AIDS that are immunocompromised. Chronic pulmonary histoplasmosis can occur where the signs and symptoms look a lot like tuberculosis. And this is actually endemic on all continents except for Australia. Another causative agent, Pneumocystis jirovecii. This is agent of the pneumocystis pneumonia or PCP pneumonia. Again, unfortunately, one seen with individuals with AIDS. The organism is called Pneumocystis carnea. It's probably part of the normal flora in healthy people. So again, something that we're exposed to, but if immunocompromised or those in AIDS can become a problem. This fungus multiplies intracellular and extracellular. Traditional antifungal drugs are ineffective, though, against these organisms or this organism. All right, so if we, again, kind of summarize all of these, some of the multiple causative agents here of pneumonia. So rhinovirus can be spread by droplet contact or endogenous transfer. Again, good hygiene. There is no treatment for the virus, but it is typically mild. Streptococcus pneumonia, though, again, also droplet contact or endogenous. It does produce that capsule that makes it hard to go through phagocytosis. Treatment with doxycycline and some some other antibiotics. However, again, resistance is becoming an issue. And this does typically cause individuals to become severely ill. The mycoplasma pneumonia, this is the one without a cell wall, so droplet contact does produce adhesins to help it attach. No vaccine, but it is susceptible to erythromycin, and typically mild and referred to as walking pneumonia. The Legionella species, this is the one, again, sorry about that. This is the one, the Legionella, that's mainly going to be associated with water. So again, spelunkers, because the caves are kind of typically moist, so it's common in those. It is treated though by fluoroquinone, azithromycin, or clarithromycin. This is again also typically mild in healthy individuals or no symptoms at all. However, it can be severe in the elderly or immunocompromised. Then the histoplasma capsulatum is transmitted by vehicles, so inhalation of those fungal spores. It can survive inside the phagocytes once it has been undergone phagocytosis. So prevention helps by avoiding soil that has those droppings. There is treatment with an antifungal, but again, many times it is asymptomatic, except for those who are immunocompromised. And then another fungal cause, pneumocystis jirovecii, again, transmitted by those fungal spores. Treatment by some antifungals, but again, this is typically the one that is most associated with individuals with AIDS. Then there's also healthcare associated pneumonia to be discussed here. Lots of causative agents, but about 1% of those hospitalized will develop pneumonia. So not coming in with it, but this is one of those nosocomial infections where somebody gets this because they were hospitalized. Most often associated with using some type of ventilator or trach tube. And about 30 to 50% mortality rate, though, that is seen in this. Lots of causative agents. So MRSA, typically with Staph aureus, Klebsiella pneumonia. There's Enterobacter, E. coli, Pseudomonas aeruginosa, Acinetobacter, and then even the majority that are caused by multiple organisms causing the pneumonia. So prevention and treatment. So most cases, again, are due to aspiration into the upper respiratory tract. So elevation of the head at a 30 to 45 degree angle helps to reduce that aspiration of secretions, deep breathing and frequent coughing to help expel anything. Again, proper care of the ventilation and respiratory equipment to prevent it from being transferred. Empiric antibiotic therapy should be started as soon as possible whenever this is suspected. So looking at this again, multiple agents, so it is caused by multiple bacteria from the upper respiratory tract or the stomach, as well as environmental contamination. So again, typically this is caused by endogenous species. So prevention, again, elevating the head to prevent them from being exposed. Preoperative education and care of respiratory equipment to prevent accidental transmission. All right, now switching over to the hantavirus pulmonary syndrome. This is actually a relatively newer syndrome that is, or disease that has been a factor. So first seen like in 1993. This was actually seen in young, healthy adults that died within a few days. This hantavirus, the agent was previously only not known to cause severe kidney damage, hemorrhagic fevers in parts of the world. But again, it's an emerging disease causing about a 33% mortality rate. Some of the signs and symptoms, the prodromal phase, kind of the original kind of early onset, fever, chills, muscle aches, headache, nausea, vomiting, diarrhea. Cough's common, but not prominent early on, but then severe pulmonary edema, acute respiratory distress can occur, severe breathing difficulties, and a drop in the blood pressure. After that, hantavirus agent spreads through the blood. So caused by the hantavirus, it's airborne virus that's emitted from rodents. The virulence is the ability to induce severe inflammatory response. So prevention is avoiding mouse habitats and droppings, and supportive care is what is used. However, this is one that is listed as a bioterrorism agent. All right, and then just kind of summarizing all of these, ending with the various microorganisms. So again, multiple bacteria that are linked to our respiratory infections, including ear infections, pneumonia, pharyngitis, whooping cough, all caused by bacteria, as well as tuberculosis. Our viruses causing RSV, influenza, hantavirus, and pneumonia. And then a few of the fungi we mentioned here, some that can cause, though rare, an ear infection, that histoplasmosis that leads to pneumonia, as well as pneumocystis pneumonia that can occur by fungi as well.